I'm Dr. Mark Sawyer. I'm a pediatric infectious disease physician at Rady Children's Hospital in San Diego and a professor at UCSD School of Medicine. We have produced a series of videos to help physicians communicate with vaccine-hesitant parents. These videos can be watched individually or as a group and are made as part of a larger project called Immunization for San Diego Kids. Here are the partners that join forces to produce this video, and the overall goal is to improve immunization rates by addressing vaccine-hesitant parents effectively. Our objectives for you after viewing this video is you should be able to describe the problem of vaccine hesitancy in our community, describe some effective communication styles to address common vaccine safety concerns, and list some new messages you can use in communicating about vaccine safety. I want to remind you, as you struggle with the communications you have to do every day about vaccine safety, that vaccines are very effective at preventing disease, and this particular graphic just shows the marked decline in invasive pneumococcal disease from the time before we had a pneumococcal vaccine until after the initiation of that vaccine. So keep in mind that this is all for a very good purpose. The goals in general of vaccine hesitancy communication is to have parents use their provider as the source for accurate information about vaccines. We want parents to accurately assess the benefits and risk of vaccines. We want parents to realize the information on the internet that they may come across may be incorrect. And overall, we want to protect more children by increasing immunization coverage rates. This is some data, national data published by CDC over the last few years of vaccine coverage rates for 3 common vaccines, DTaP, MMR, and hepatitis B. And at first glance, these numbers don't look too bad. But if you look across the slide from 2008 to 2012, you'll see that we're gradually slipping in our immunization coverage rates. This is data from San Diego and California for so-called personal belief exemptions. These are parents who decide to exempt their children from school entry requirements for vaccination. And as you can see, over the last decade or more, these rates are gradually and continually rising, so that in San Diego County, we're now at over 4% of kindergarten students having exempted at least one vaccine. If those rates of under-immunized children were spread evenly around our community, it might not be so bad, but as you can see on this map, they're clustered. This map shows individual schools by yellow dots, and the size of the yellow dot correlates with how many children in that school are not fully immunized. The largest dots represent schools with 20 or more kindergartners who don't have a full set of immunizations. And you can see they cluster in certain communities. So what we need to convey to parents who live in those communities is that their children are at particular risk because people around them are not immunized as well. The problems that are created by vaccine hesitancy and under-immunization are obvious. We have had outbreaks of measles, which have reached record numbers in 2014. We have pockets of under-immunized children, which are clustered geographically, as you saw on the map. And overall, our community protection is about to be lost, so that even immunized children are going to be involved in outbreaks as they get bigger and bigger. Here are the common issues that we're going to go through in this video with pediatricians talking about how they address them with parents. And you have all heard these issues probably many times. The overarching question that you get from parents is, are vaccines safe? Still, a very common concern is about vaccines and a link to autism. And similarly common is the question about whether we're overwhelming the immune system. Sometimes you hear that natural immunity is better, and parents taking their children for chickenpox parties so that they can get the benefit of natural immunity. You also hear that the diseases either no longer exist or they aren't that dangerous. Sometimes you hear that it's all a giant money-fueled conspiracy of the pharmaceutical companies, and the thing you hear the most is that it's my right to decide what's best for my child. And there's no doubt that that last statement is true, but we want to make sure parents have good information when they make decisions for their children. This segment includes a number of video clips that deal with vaccine safety, including vaccine safety in general, vaccine ingredients, the purported link between vaccines and autism, and the questions you get about whether vaccines overwhelm the immune system. This first clip is on general vaccine safety issues, and in it, Dr. Levy does a nice job of framing the big picture about vaccine safety and the effectiveness of vaccines. He provides reassurance that vaccines are safe and reminds parents that the diseases are still around and that they're dangerous. He also quotes local or personal experience, which is a very important tool in making the message resonate with parents.
Well, we have some questions today about vaccines, and I was just wondering how safe vaccines are.
Vaccines are very safe. What's not safe is the diseases that they protect against. And I think what's happened over the years is people have lost sight of the nature of these illnesses. Donovan is due now for measles, mumps and rubella vaccine and for chickenpox vaccine. And many people think of chickenpox as just a few spots and a little fever and no big deal. But the problem is that the virus can produce spots almost anywhere. There was actually a case here in Encinitas several years ago where a little 5-year-old got chickenpox in the days actually before vaccine, and the chicken pox was right on the part of her heart where the conduction occurs, and she died from that.
While we're on the general topic of vaccine safety, we should remind ourselves how we know that vaccines are safe. First of all, hundreds of millions of doses of vaccine are given every year in the United States, and billions of doses are given around the world. Even very rare side effects will come to our attention. And then as a result of the concerns about vaccine safety in the United States in the last decade, the infrastructure for studying vaccine has been enhanced. There's the Vaccine Adverse Event Reporting System, or VAERS, which you should use to report even a suspected vaccine side effect. The CDC has developed the Vaccine Safety Data Link, which is a group of managed care organizations with electronic health records, which allows us to study scientifically proposed links between a vaccine and any side effect. The Clinical Immunization Safety Assessment Network is a group of scientists who study vaccine side effects and their causes, and then the Food and Drug Administration studies vaccines for safety before they're licensed, and the CDC monitors vaccine safety on an ongoing basis. The next 4 clips compare vaccines to other prevention steps parents take with their children. One important message you'll hear from Dr. Bowers is about the unpredictability of infectious diseases with regard to time and place. Dr. Mendenhall shares her personal family vaccination status, which can be a very powerful way to demonstrate the importance you place on vaccines and your trust in vaccine safety.
If it's your child that happens to, it's unbelievably tragic and it's preventable. So why not, we put our child in a car seat to help prevent car accidents and prevent those. Do I know when I'm going to be in a car accident? No. But I'm going to put my child in a car seat every single time they're in a car because there's that possibility. It's the same thing. Do I know when my kid's going to be exposed to pertussis? Nope. Sure don't. But I'm going to give them that vaccine to help protect them, because when they are exposed, I want them to have the maximum protection possible.
Not only are the vaccines themselves not dangerous, but the diseases that they prevent against are particularly dangerous. So really what we're looking at is a seatbelt against an auto accident. And while it is possibly true that a seatbelt might hurt you somewhat in an accident, the chance of it saving your life is high. And I think seeing a vaccine that way is helpful.
I like to think of it like, well, you know what, I have a car seat and I'm just going to use it part of the time, right? Because, I'm probably not going to get in a car accident. It's probably going to be fine. And, well, yeah, but I can't predict when you are going to be in a car accident. And as I like to tell my teenage patients, there is no rewind button in life. I can't stop it, rewind it, go back to the house, put my helmet back on, get back on my bike, get in my accident, and protect my head. I got one shot at it. And so to do that, you always have, as you're saying, you have to be ever vigilant. You have to do what's best for your kid and help protect them as much as possible.
So you're a mom, so do you vaccinate your kids?
I do. I have a 7-year-old and a 9-year-old, and they are fully vaccinated. We followed the American Academy of Pediatrics schedule, and I'm a firm believer of all the vaccines. And if I weren't, I would let you know. We would talk about it. But they're all there for a very strong reason to help protect your child.
This next segment is about vaccine ingredients. In the first clip, Dr. Bowers addresses mercury and thimerosal, which we continue to hear about, and she explains that thimerosal has been removed from vaccines. That should pretty much end the conversation, but parents continue to ask about it. I might suggest that rather than say, as she does, that thimerosal is still in multi-dose flu vaccine, just say that your child can get all the recommended vaccines without being exposed to thimerosal. In the second clip, Dr. Levy addresses aluminum, which is becoming the most common ingredient question doctors are getting. He does a nice job of concisely explaining the overall environmental burden of aluminum and minimizing the exposure through vaccination.
Yeah, I guess my first question is, are they safe?
Is there something in particular you're concerned about in terms of safety?
I've just heard that there's like chemicals and stuff that are actually in the vaccines, like mercury and stuff that might not be good for the babies.
The most important thing in terms of vaccinations is that they are here to keep your baby safe. But she's also your child, so you always have to make the best decisions for your child, and you have to be 100% comfortable with whatever you're doing with her. One thing you brought up was the mercury in the vaccine, and so the thimerosal and mercury used to be in childhood vaccination. So that is true. However, since the year 2000, there's been no thimerosal in any of the childhood vaccinations except the multi-dose influenza vial, and that one's only given to kids over the age of 3. Oh, okay. So that actually wouldn't even impact Audrey at all.
You may have heard as well that there's aluminum and mercury in the vaccines. There's aluminum in lots of things, actually lots of aluminum in breast milk. Of course in aluminum foil, which people use all the time with, without hesitation to wrap things up. So these are not important parts of the vaccine. The aluminum is actually a very important component of the vaccine in terms of its efficacy. It doesn't work as well without the aluminum.
In addition to mercury and aluminum, this slide shows other ingredients that you may get questions about. This section of videos covers autism, which we all get asked about on pretty much every discussion about vaccinations. It's a very important communication tip is demonstrated by Dr. Mendenhall at the very beginning of this segment. She empathizes with the parent about how overwhelming it can be to make decisions about vaccination. Also in this set of clips, you will see how firmly the pediatricians state the lack of a link between vaccines and autism. The science now allows you to be emphatic in your statement about this. Don't waffle.
So I heard vaccines cause autism. I don't want my baby to have autism.
Oh, I understand. I don't either. But autism is pretty much predetermined. There's some genetic factors and some other environmental factors that we're still researching. But the vaccine and autism link has been fully researched, and there's actually zero link. The National Autism Society will tell you that as well. And there's study after study that shows that kids that are immunized and unimmunized have the same rates of autism.
There is no association between vaccine and autism. Yes, there is more autism today than there was even 10, 15 years ago, but it's not from vaccine. There are theories about why it might be happening, and I can discuss those if you'd like, but really from a vaccine standpoint, it's clear that there is not a link between any vaccine and autism.
Do we know what causes autism? Exactly? No. Autism, the more they study it, the more they find it really is multifactorial. There's been some very recent research showing that there may be some antibodies within the mother while the baby is in utero. And then is there an environmental factor that goes into play? And so the answer is probably yes, yes, yes. Within the United States, there have been several studies looking at, is there MMR and autism connected? Is thimerosal and autism connected? Is this and autism connected? And every time it's always been a no.
So as you can see, communicating about autism can be tricky. So here are some communication pointers to keep in mind in general when you're talking with vaccine-hesitant parents. First of all, you need to be respectful of their opinions. They're only interested in the best outcome for their own children. You need to empathize with them on the difficulties they are having in making a decision about vaccines. You need to listen attentively and ask where the information that has raised their concerns came from. Whenever possible, use personal stories from your practice to emphasize the points you'd like to make. This next segment helps you deal with the questions you get about overwhelming the immune system and spacing out vaccines. In the first two clips, Drs. Mangine and Levy give nice examples of explaining the capacity of the immune system of babies, as well as the increased purity of vaccine that leads to less immunologic exposure through vaccines than it used to be in the past.
So one of my concerns is the number of vaccines a child has to get at one time. What is the benefit of that, or is it better to spread them out?
I think it's a very valid concern, and I think for many parents, we worry that we're giving their babies too much vaccine or too many shots. And so I like to put in perspective, because what people don't realize is that vaccines are proteins or sugars that the immune system can recognize. They call them antigens, and a normal newborn can process 100,000 separate antigens at the same time. It's an enormous amount. If you got immunized as a kid, you will have got polio vaccine, which was a live virus in those days, and DPT. There were about 2,000 antigens in that vaccine combination, which sounds like a lot, but if you can process 100,000, it's not a great deal. So although babies get today vaccination against 7 different illnesses rather than the 4 we got, and they get 3 shots rather than the 1 shot we got, they only get about 150 antigens. That's less than a tenth of what we got, and what 1% or less of what they can process, what they can manage.
Your baby has an amazing immune system. Think of all the germs that your baby is exposed to every day. Millions, many on your hands. Us moms have about 150 different germs on our hands, and we touch and cuddle our babies all the time. Your baby's able to handle those vaccines because as science has improved our vaccinations, we've been able to decrease the amount of medicine that's needed in the immunizations. When you and I were kids, we got 7 immunizations that had about 3,000 antigens in it. And now with our refined vaccines, we can protect babies against more illnesses, but only 150 antigens.
I want to remind you to be careful with numbers. Dr. Levy made a little error in saying we protect against 7 diseases when I think he meant we use 7 different vaccines, since some of the combination vaccines actually protect against more than 1 disease. And Dr. Mangine quoted a study that found 150 different bacteria on your hands. There are probably other studies with different numbers. So you don't want to have your credibility questioned by quoting precise numbers unless they're absolutely solid. The next couple of clips point out the risk of spacing out vaccines and a nice explanation of the fact that vaccines are studied with simultaneous administration, not as a spaced out series. There is the potential that they might not work as well when they're spaced out because of immune interference following the administration of one if another is given shortly after. This clip also points out that spreading out vaccine leads to multiple painful visits to the doctor's office. Most parents and babies prefer to get it over with. The last point made in this sequence emphasizes that spreading out vaccine is actually placing your child at risk.
We know that there are some negatives to spacing them out. First of all, you're not going to be fully immunized. You're not going to have that immunity, and you're going to come into contact, your infant may come into contact with the disease before they've had the vaccine. So we've shown that you actually make a better immune response if you get the vaccines together rather than spacing them out a week, come in once a week for 4 weeks, or do you come in every 2 weeks for 8 weeks? There's no research showing that that's going to be effective with your immune system. If you're making an immune response midway, you get another vaccine, you might not respond as well to that. Okay. And you have to come in more, and every time you come in, your baby gets a shot. So sometimes it's nicer just to get them over with all at once, and we have not found any problems with giving them all together.
There's really little point in waiting. Every vaccine you wait on, and people do this, they'll separate out the vaccines and give a couple at one visit and a couple at another visit. Every time you do that, you're leaving your baby exposed to and not immunized against those diseases, so they're at risk. Some diseases are certainly more risky than others, there's no doubt about that, but why take a risk at all?
This segment deals with the question you get from parents about whether natural immunity is better than the immunity we get from vaccines. In this clip, you'll see another example of quoting personal experience. Dr. Mendenhall quotes her personal experience with a disease that's being discussed. Most importantly, we need to point out the price of natural immunity when we're talking about this topic. The price is death and disability for some. Do you really want to take that risk? We need to plant that question in parents' minds. This is emphasized for measles in the video clip, which most parents don't realize is a particularly dangerous disease.
So back in our day, we had natural immunities to such things as the flu and chickenpox. Some of my girlfriends are hosting chickenpox parties in which all of the kids get together and kind of get chickenpox together so that they can all be immune together.
Well, back in the day, I had chickenpox. It was definitely not fun as a 17-year-old. But it's one of those things that if you get chickenpox, then a couple things can happen. You can get shingles any time thereafter in your life, which is very painful, and you don't feel good. Again, I know from experience, unfortunately. You know, most people think it's relatively benign. It's kind of a horrific week for the kid and the parents all involved with pain and itching, but there can be very deadly repercussions of that disease.
Kids every year die from chickenpox. If it's your child, then it's 100%. You know what I mean? It's a zero-sum game. It's your kid. Why would I not want to protect my child from that potential outcome?
Measles, on the other hand, is a much more dangerous illness. You know, as we protect against these illnesses, we're looking not just as the little rash and the spots and the fever, but at the bigger picture of what the disease can do in the long haul.
So when we're talking about whether natural immunity is better, we do have to acknowledge that for some infections, natural immunity is better because the immunity lasts longer. But at the same time, we have to point out that natural immunity is not complete. So for example, with whooping cough, you get reinfected even after natural infection, and we all know that young babies can have more than one course of rotavirus. And then they also have to keep in mind that there's multiple types of some diseases, like pneumococcus, where we have more than 20 serotypes of pneumococcus that cause infection. So infection naturally with one only protects you against that one, unlike the vaccine, which the current vaccine protects against 13 different strains. And then again, we need to make sure parents keep in mind that natural immunity comes at a price for some children, and that price can be very severe: deafness, brain damage, hospitalization, paralysis, and permanent scars. This segment deals with the concept that some parents have that the diseases are not around anymore. In this clip, polio is used as an example of a disease that's not around anymore. And although you can talk about the continued spread of polio, I think it might be more effective to talk about diseases that we are much more likely to see in the United States, such as measles or mumps.
So do we really need to vaccinate for the diseases that are no longer around, as in polio and things of that sort?
We actually do still see polio. We wish we had worldwide eradication, but what's happened is that more and more people aren't immunizing, and so then we're seeing outbreaks, like we have a measles outbreak right now.
Dr. Bowers makes the point very well here that the problem is that we have a rising number of unimmunized children and a highly mobile society. The one plane ride away comment conveys that very nicely. This is a situation where you can probably quote a recent experience in the United States in general or in your own community where disease has been imported.
We live in an age where everything is one plane ride away. So somebody goes, hangs out, maybe they were not vaccinated or under-immunized, they fly back, they hang out with your kid may or may not be 100% immunized, now your kid has that illness.
The last point made in this sequence of clips is to shake the confidence of parents in herd immunity. We'll also hear more about that in the next segment.
So it is something that we think we're safe from because of herd immunity. Everyone else is getting vaccinated for it. But what we're seeing is some people aren't vaccinating, and then we're seeing recurrences of diseases that historically haven't been seen.
This segment is about parental rights to decide whether to immunize their children and the topic of herd immunity, which are related topics. In the first two short videos, you'll see Drs. Levy and Bowers discuss parental rights to immunize. They do reinforce with parents that it is their right to make a decision about immunization, but they also remind them that they need to be aware of the risks that they put their children under.
Find out what, if I have to get her vaccinated, or if I don't, if that's something that, I can choose not to do.
Okay. Well, in California you can choose as a parent not to vaccinate your child, but you do leave them at risk. And the problem is that these are diseases which for the most part are potentially lethal. The one vaccine that we use called rotavirus, which you have to give as an infant, and I don't know if she got that when she was little, that can't be given later on. So if you miss that by the time you're about 5-6 months, then you don't have a chance to go back to it. But in fact, it's the one disease that in the US is not lethal, because you can put a baby in the hospital or a child in the hospital and put an IV in and keep them hydrated. It's just a terrible diarrheal illness with a risk of dehydration, and in many parts of the world it can be a lethal disease. But all of the others are potentially lethal, and I think it's important to understand that these are not small things.
It's my right to decide what's good and what's bad for my child. So what if I homeschool my son? Do I still need to give him vaccines or not?
So it's an excellent question, and number one, absolutely, you are the parent of Donovan. So just like with vaccines, you want to make sure that you're doing the right thing with him. Just like with around a pool, you're not going to let him be all by himself around a pool. You're going to be vigilant and you're going to be with him. Absolutely, it is your decision in the end to do what's best for Donovan. I hope that you think about the other potential morbidity and mortality of these diseases that are still there.
These next two clips will discuss the topics of herd immunity and whether homeschooled children are at decreased risk from vaccine-preventable disease. In this clip, Dr. Bowers addresses homeschooled children, and then she provides a very good approach to reminding parents of the many opportunities their children have to be exposed to infection, and that homeschooling doesn't really prevent that. This section also brings up the very important point that like-minded people tend to cluster in the same neighborhoods and playgroups and schools and activities, so that the children who delay vaccines are actually at higher risk because they're in the same environment with other unimmunized children. Dr. Mangine makes some other very good points about herd immunity in her segment.
With kids who are homeschooled, in theory, yes, they're spending more time in the home, so they don't have as much time out. However, most of those kids do have outside activities. They go to gymnastics class, they're doing horseback riding, they go to art camp, they go to the grocery store with their parents. They might fly on a plane somewhere to go visit family in other areas. So it's not that there's zero, they're not living in a bubble. You're hoping that everybody else is vaccinating and that the herd immunity for your child will be high enough that enough other people are vaccinated to help protect your child. Unfortunately, you can't guarantee that. Not everybody else is vaccinating, so the herd immunity is often lower than they think. And it's definitely lower in certain populations. So it's probably going to be lower among other homeschool kids because they may be, like-minded people, or particular schools in the area, maybe certain charter schools or certain public schools do have lower vaccination rates. Well, I'm not going to vaccinate because I know everybody else is vaccinating. Well, the issue is not everybody else is vaccinated.
If other people are protected, it does confer some herd immunity, but there is a problem with herd immunity. First of all, it's not 100%. Secondly, there are some people who cannot be vaccinated, for example, babies who are too young to receive their first vaccinations. A good example right now is the measles virus, which we don't vaccinate for babies under 12 months, so they are susceptible and can still contract and pass it to other people. The other concern with the herd immunity is that our immunization rates are declining, so you can't count on other people to be vaccinating too.
Herd immunity can be a difficult topic to discuss with parents. The way I try to explain it is to have parents imagine a school or a playgroup in which almost everybody's immunized. In that setting, if someone comes into that group who's not immunized or can't be immunized, the chances that they're going to get an infection is low. But if you take that same school or playgroup and let's say 2/3 of the children are immunized but 1/3 are not, then the chance of disease spreading within the school is much higher because not only one child gets it, but several children get it. And pretty soon, everybody's exposed to the disease. This segment is about the frequent question we get about hepatitis B vaccine at birth and whether it's really needed at that time. The first clip you'll hear is a response to that question. Why do we need to give hepatitis B at birth when it's transmitted by sexual activity or blood transfusion and my baby's not going to be exposed to those things? Dr. Levy does a nice job of reminding this parent of the other transmission possibilities and then the consequences of hepatitis B when infants get infected with it.
Their chance of getting Hep B is very small, but it's not zero. About 1/3 of cases of Hep B are household transmission. So we know that you don't have to have sexual contact or blood transmission, blood contact to have transmission of the virus. And so babies who are out and about in the world and touching things and putting their hands in their mouths are at risk for getting Hep B. The big issue is that an infant or a child under 5 who gets Hep B has a far, far greater chance of getting cirrhosis of the liver or liver cancer. So it's important to protect them before they actually are in contact with the world.
Thanks for watching this series of video segments. They were intended to show you different styles and different messages that you can use in your communication about vaccine hesitancy. So we're hoping that you can incorporate some of them into your practice as you continue to talk to parents about this very important topic. The first website on the list is the Immunization for San Diego Kids website. That's the project that developed these videos. I'd like to point out a few others. The National Network for Immunization Information, NNII, is a useful site because it has a section that teaches parents how to judge the credibility of what they're reading on the internet. The CDC site has good information for both providers and parents. And of course, the American Academy of Pediatrics at aap.org has an excellent immunization section. But all of these sites have useful information for both you and your families.